Hello, everybody, and welcome back to our How To Corner. I am Dr. Will Gray III. In today's episode, we're going to talk about hip replacements. Before we get started, please like, share, follow, subscribe, comment, leave questions in the comments, and we'll be definitely willing to answer any question that you may have. With that being said, let's get going. So today's agenda for our talk, we're going to discuss what is a hip replacement, the anatomy of the hip joint, the reason for replacements, the types, as well as surgical procedures, prosthetic materials, post-op care, rehab, recovery, risk, complications, and outcomes, as well as prognosis. And we're going to start with what is a hip replacement. So a hip replacement or a total hip arthroplasty is basically a replacement of a degenerative slash damaged hip joint. Now, that replacement consists of what we call a prosthesis. It has certain parts. You have the ball and the socket with artificial ones as far as how they're made of metal, ceramic, and as well as plastic. The ceramic is really the most common type when it comes to the ones that I think a lot of younger people have and use, as well as this thing is done in order to help relieve pain, improve your function, restore your mobility, that is typically due to conditions like osteoarthritis as well as trauma of the hip joint. So that's pretty much in a nutshell what a hip replacement is. Now, the hip anatomy, as far as it concerns what bones are involved or what bones are pretty much replaced, you have the femur and the pelvis. Now, specifically, the head of the femur is what's replaced, is called the ball, and then the pelvis or the acetabulum itself is the socket. Those are the two areas in this replacement that have to be addressed or probably are problematic. Now, with that, you have a covering that's called the articular cartilage that's replaced by the prosthesis also, as well as the ligaments and muscles supporting the hip. The function of the hip joint is mobility with weight bearing as well as stability. And it helps you to be able to do a lot of the things like squat. So when I talk about mobility, weight bearing, stability, squat, you're able to move around your hip. So your hip is pretty much used for a lot of different things. Now, reasons for a hip replacement. Obviously, osteoarthritis, rheumatoid arthritis, AVN, or avascular necrosis, hip fractures, congenital hip disorders, as well as sports-related wear and tear. For most common, we have a certain age group above about 60, 65 that tend to have the osteoarthritis. That's an issue. And then we have some congenital things as well as just some health-related things that cause you to have AVN, as well as trauma like car accidents of that kind of things of such as falls, especially when you become over age 65. A fall is detrimental to your health. And then, last but not least, there's sports-related deal where you played football. Football is definitely a sport that has that issue as far as people having to have hip replacements thereafter, as well as basketball and other sports too. Hockey is one of the sports that you have a lot of people or players who have hip issues throughout their career, which then eventually lead to a joint replacement. Now, let's talk about the types of hip replacements, right? You have the total hip, partial hip, hip resurfacing, cemented versus uncemented prosthesis, which is what we call a press fit, as well as the reason for those types of replacements. So let's start with the total hip. Total hip, pretty much standard. The degenerative joint, they're going to replace the ball in the socket. Partial hip replacement, maybe the acetabulum is fine, but they're going to replace the ball itself, as well as the hip resurfacing. They're doing some smoothing, trying to remove some bones that could be of problem. And then the cemented versus uncemented prosthesis. This is really good discussion here. The cemented one is going to be used for people who are a lot older, who have a weaker bone um, structure in a sense, where the bone has become weaker over time. So they use that cement to order to give it more stability. Versus uncemented, you're going to give to a younger population, and it's because of the fact that they're a lot more active and their bone quality is a lot better. Now, surgical procedure overview. Incision approaches. Most common incision approaches are posterior. They're starting to be a little bit more back and forth when it comes to the approach. You have the anterior approaches becoming a lot more, how can I say this, usable or common now too. Lateral is kind of, not really a thing that you do as much anymore. Only particular situations will require lateral procedure processes. So the process of how the procedure occurs and how they do what they do a pre-op prep, obviously removal of the damaged bone and cartilage during the surgical procedure, placement of the prosthesis components, the acetabular cup, the femoral stem, head, and then that surgery lasts about 1 to 2 hours. omitting any type of complications that could occur. Now, prosthetic materials, metal on plastic. Most common, that's used. Metal on metal, least common, the ceramic is used in a lot younger individuals. And then these implants roughly last 15 to 20 plus years, depending on individual as far as size, activity, weight, stuff like that. So these are the pretty much the prosthetic materials that are used. Now, let's talk about the post-op care, which is pretty much what we specialize in. Hospital stay, pain management, and this day and time of hip replacements, you tend to have a one-night stay for the most part. When you come to a total knee replacement, sometimes they send you home the same day. That's a whole different conversation within itself. The world of healthcare is definitely rapidly changing, some good, some bad, but that's tend to be the thought on the stay. Pain management obviously is done with medications, ice, as well. You're going to use walker crutches to do your ambulation. Most of the time, they give you a walker, depending on your actual age group. Most of the time, or your comfortability with the actual AD. Wound care, infection prevention is super important. Make sure that wound stay clean. Making sure that you're doing what you need to do as far as visualizing the wound, looking at it, making sure there's not any type of change in wound color or warmth or temperature or any type of actual coloration or discoloration. Hip precautions, avoiding all dislocations. If you have a hip replacement, it depends on the approach. You want to avoid certain positions, and they will be listed in your discharge instructions. If they're not, please call and ask your doctor as well as your therapist what are your hip precautions in order to make sure you don't dislocate. You do not want to dislocate. It is very, very excruciating based on what I know from having clients that actually have came to me after a dislocation of their hip. Now, rehabilitation and recovery continue. Physical therapy goes. We want to restore your range of motion as quick as possible, improve your strength, and gain your gait. Recovery timeline can range from 6 to 12 weeks on average, but it can be 6 to 12 months for more difficult cases. In addition to this, return to daily activities in low impact sports. That's a pretty much cut and dry what we are trying to accomplish in the rehab portion. With that, there are some things you need to make sure you're aware of. If you're not maintaining your precautions, making sure that you're actually attending to your wound and make sure there's not any type of issue with your healing and attending on your appointments, this particular timeline can become longer, okay? So just remember that. Risk and complications, pretty much what I talked about. You have infections of that particular incision area, as well as blood clots from immobility. You're not going to your appointments. You're not moving. You're not listening and staying on top of what you need to stay on top of. And hip dislocation, because those precautions, you're not paying attention to them, as well as prosthesis loosening or wear. Prosthesis loosening happens a lot of times, believe it or not. Sometimes you get the wrong prosthesis for said client doing their hip replacement. Pray to God that the actual doctors don't do that. They have to measure and do different things to make sure things fit properly. And then the wear, just how much pressure and things you put on the joint. And nerve and blood vessel injury. Due to the fact that the hip replacement is in the area of your femoral triangle, where you have your femoral nerve, artery, and vein, there can be some things that occur that can disrupt your actual healing, as well as complicate the hip replacement after surgery. Now, outcomes prognosis. Usually, if you do everything you're supposed to do, follow the script, nothing happens, no complications arise, you pretty much gonna have a decrease in pain and improvement mobility as well as quality of life. And then the success rates are pretty high because that joint is a pretty big, stable joint. So long as you do what you need to do, usually you're able to maintain a really good outcome throughout your life of the prosthesis, as well as long-term activity recommendations. Sometimes they are actually decreased because that particular joint, you're trying your best to extend the life of the joint. So you will have some modifications. But with that, if you do everything you're supposed to do, have a great therapist, great surgeon, have a great caretaker, as well as trying to make sure that you're putting your best foot forward. Usually recovery from hip replacements can happen pretty standard as far as 6 to 12 weeks. Now, if you have any questions or concerns, definitely, please find us on all platforms. Reach out to us, send us messages. You can go to our website, contact us, and let us know if you have something you want us to answer for you. And also, check out our TikTok, YouTube, Facebook, as well as Instagram accounts. We have different things we post there. We try to make sure we put as much information up there as possible to keep you informed and allow you to be able to reach out to us. Now, hopefully you learned a lot from this particular talk. And if you have anything else you want us to address, just leave it in the comments. Thank you. Have a blessed one. I'll catch you in the next one.